Welcome back to the show, and a very different, should we say, different but yet interesting topic this morning. A 9-year-old boy going through a very, very grueling situation, and just let me give you a bit of insight into it. Rodwell Komazana, age 9, was taken into hospital on a gurney at the Mediclinic Santon Hospital in Santon on the 19th of June for plastic surgery. And Rodwell, as we know, was basically attacked by a hyena in the Zimbabwe area. And this has affected his nose, his left eye, most of his upper lip, most of his forehead as well. And the poor boy was attacked literally during a nighttime church service outside his area in Harare. And to give us more insight into what is happening as far as the story is concerned, we have with us Dr. Ismael Mitha and Dr. Mohammed on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much and a warm welcome to the show. It's such a pleasure having two phenomenal doctors joining us on the show this morning. And we firstly want to commend you for all the work that you've been doing on the front line. It has been a war zone out there, as we see every single day.
Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah Nafisa for hosting us. I just like to point out that Mohammed is not a doctor. He is actually he is our CEO at the
he has that doctor look, you know.
So basically, I'll be providing the medical update, and Mohammed will basically fill us in on the as well as the Meal SA fundraising initiative.
Lovely.
Just very briefly, I just want to tell you how we got to where we are. So there's a sister, Shuda, who called me probably about 3 to 4 weeks ago, saying that, you know what, she's a sister who used to work at Mill Park Hospital, and she was contacted by someone who she knew and worked with previously in the wound clinic in Zimbabwe, who said, please, can we help this child? The child was mauled by a hyena, and essentially the child has got no face, right? And that's why we're calling it the face of Rodwell fundraising campaign. So inshallah, the plan was, subsequent to that discussion, was to bring him to South Africa and to arrange a team of doctors who would be instrumental in bringing back or reconstructing his face. So essentially, I reached out to Ridwan Mia, Dr. Ridwan Mia, who is a plastic surgeon who we've worked with previously when we brought a Palestinian child who had a fracture of his eye, or his orbit of his eye. So effectively, we assembled the same team, and Alhamdulillah, the Rodwell arrived in South Africa on the 19th of June. And we proceeded to do the initial surgery, which was called an examination under anesthesia. And the other doctors on the team is a Dr. Jamil Desai. Dr. Jamil is a maxillofacial surgeon. Dr. Razvi is an ENT specialist and head of ENT at Baragwanath Hospital. We've got Dr. Hizar Mukaddam, Dr. Sai Munsami, and Sister Makshuda, who went to Zimbabwe to pick the child up. They brought him on an Airlink flight, and so Sai is looking after him from a pediatric perspective. So there's a whole team that are looking after him from a medical reconstruction and
following the story, Dr.
where we are currently. I can't hear you.
Yes. Before we go into that, can you hear me now?
Sorry, I can't hear you.
You can't hear me. So let's try that again. Can you hear me now? I'm going to try and can you hear me now, Dr. Mitha?
I can see you mouthing. I can see you verbalizing something, but I can't actually hear you.
Okay, let's see if we can sort this out.
But what had happened?
Okay, can you hear me now, Dr. Mitha?
So what had happened was, I'm going to just finish.
Okay, give me a second.
So
Give me a second. I'm going to go to
sure.
Mohammed. Mohammed
Okay.
Mafman. You know what? I think it's important to see people like yourselves giving back in many directions, coming from Real SA, and I think it's phenomenal work that you've been doing. Talk to us about your involvement as far as this is concerned, because as we know, the situation is very dire. The poor boy went through a very grueling situation, and I was going to even talk about his tenacity. He still had that positive situation where I read one of the days that he was still even interested in doing his homework. So let's talk about your aspect and your part that you've been playing in this to be able to make such a difference to a small 9-year-old child who has so much of life that's still ahead of him, going through such a grueling situation.
Assalamu alaikum, Sister Nafisa.
Walaikum
Jazakallah
salam.
khair. So I think right up front, Ismael corrected that I'm not a doctor. Some would say that I doctor financial records, but that's probably the sum total of being involved there.
I think
So
from the
Alhamdulillah,
type of
me,
work
let's
you've
say,
been, yeah, as you said, Mohammed, the reason we're laughing is because we look at you as those doctors of fixing other things besides the things that Dr. Mitha has been doing. So a correction on that.
no, so Alhamdulillah, I think just to give you a slight sense of me, let's say, we have been involved in COVID relief since about April last year, when about 8 of us got together and looked at some of the dire consequences of the lockdown, particularly food shortage. And, Alhamdulillah, till today, we have distributed more than 2 million kilograms of mealie meal to people that are in need across South Africa. And in the recent months, we started a campaign of COVID-19 relief to assist those people that didn't have food in our communities that are affected by COVID, even providing some sort of medical assistance with vitamins and the like. In the last 2 weeks alone, between Ismael, myself, and some of the other doctors, we've managed to move out about 3,000 packs to patients of vitamins. And the plight of Rodwell is something that we looked at as a board, and it took, it was something that touched the strings of our hearts, because most of us are all parents. We have young kids. This is a 9-year-old boy. The pictures that we first were given by Ismael when we looked at the consequences of this hyena attack, I mean, the youngster's face is completely taken away. He doesn't have a nose. He's got no lips. His eye socket has been completely damaged. And so we said, well, how can we assist? And one of the things that, alhamdulillah, we in the last 14, 15 months, we've been able to establish some credibility in the community. So we said we'll use our platform to collect money from South Africans at large. The cost of this kind of surgery, even as Ismael suggested, all of the doctors that are currently involved have committed pro bono services. But the hospital costs and the therapy that goes on, this is not something that gets done in a month or two. It's going to be, a few months, maybe even a year or two before Rodwell is able to function, have a fully functioning face. So Milese said, well, it's time for us to get involved, use our platform, make our banking account available to people to donate, and we'll then assist in facilitating some of the payments through to the hospitals and service providers. That's really, where we got involved, Nafisa.
Yeah. So I think that's a phenomenal thing, because it also allows the public to be able to support such a cause, because I think that's what it's about, is about upliftment and empowerment and helping them. And I mean, Rodwell is such a phenomenal child, irrespective of what he was going through. There was a picture that really got me going, where he was still sitting with his face all mauled and in such a situation in the hospital, where he was still actually trying to do his homework. So I think it's such a phenomenal thing that you, as well as the public, are getting involved to be able to make that difference and change Rodley's life for the better, because he's only 9 years of age. Let's go back to Dr. Mitha. Is he still on the line?
Yeah, look, I think I'm having some technical issues, but yeah, I'm back.
No problem. Okay, it's good to have you back. Let's talk about when Rodwell got in from Zimbabwe. Paint us a picture. What was his situation like? I want our viewers to understand how important it is for them to get involved in being able to uplift and change this child's life for the better. Because as we know, it was quite grueling.
Look, it was traumatic, to say Oh my God.
No,
Can you
you're
hear me?
still on air. Yes, you are on air.
Hello?
I can hear you, Dr. Mitha.
Hello? Hello?
Can you hear me, Dr. Mitha? Okay, so Mohammed, back to you quickly. What was it like for you from the meal essay point of view, having to look at Rodwell and the type of situation he is in, and having to reach out and say, let me get the communities and the public at large to also get involved, because as we know, the situation was quite dire when he came in, and having to look at those pictures was actually very heart-wrenching to see that a 9-year-old boy going to actually pray in a church had to go through such a situation.
Nafisa, I think the key issue here is, when you looked at the pictures, you got a sense of the things that we take for granted. I have an 11-year-old daughter, and this is a 9-year-old boy, somebody's son. The extent of the damage was severe. The child didn't have the ability to actually have any use of lips. Is breathing through a tube into the nose.
That's correct.
And as I said, the eye socket was completely damaged. So there's
right. So there we go. We've got Dr. Mohammed. Yeah, we've got Dr. Ismael back on. Yes, Dr. Mitha, give us a breakdown on what you went through, and let's hope we don't have any bad signal there.
Yeah, let's hope so. No, the thing is, what's happening is, I don't know how I'm calling in from my cell phone. So obviously, when someone calls in, I've got to cut the call, and then it cuts the Salam Media link as well. So,
okay,
I'm a bit technically challenged. Mohammed will tell you. So anyway, so
we won't say much. Our doctors are very involved with other technicals.
Yeah. And the thing is, because I'm involved in the front line, there's always people calling for a hospital bed or an oxygen concentrator and medical advice. So look, we obviously riding the crest of the third wave, and it's incredibly intense. And you know what? We're inundated. But having said that, we just make dua for Allah to protect us, our loved ones, and to
yes,
to all those who are ill.
Back to Rodwell.
So
let's talk about his situation.
So where we are currently is that we've had the examination under anesthesia, and it definitely looks a lot worse. So when he came in to South Africa, we had to actually bandage his face, and it's really, the wounds are severe. He's got no skin, and literally all you can see, just to explain to people that, look, it's not again, and I'm out again.
No, are you still on air?
Can you hear me?
Are you still on air?
Can you hear me?
Back to you, Mohammed. Let's try and paint Dr. Mitha's picture, because you've been involved in it from the word go. So let's pick up from where you were telling me how bad the situation was, and having to get involved with the situation and looking at him now, because I know he's had his surgery already. Let's talk about his emotion and in his state of well-being. What's it been like for him? I mean, he's only 9 years old, so it is rather traumatic having to go through a situation like this.
So I think, Nafisa, there's two things. First is that he needs multiple surgery. So the first part of the surgery, as Ismael was suggesting, was under anesthesia to do the assessment. And the assessment is that it's much more severe than the doctors originally envisaged, and it's going to require probably a number of operations for him to actually get a fully functional face back. But for this child to have gone through this trauma and to be in this emotionally charged state, where this child is still able, as you say, he's able to continue to do his homework with his mother. He looks at his iPad. He watches he plays some of the games still on the iPad. It's actually quite phenomenal. It tells us about the resilience of these young kids. But I think, also as South Africans, we need to consider how we can improve this one child's life. I mean, sometimes we want to talk about the bigger things in life and the broader perspectives of charity and how we can go and impact the rest of the world. But here on our doorstep out of Zimbabwe is this little young boy, 9 years old, that we can make a difference for. I think that's Meal Essay's fundamental objective here. We can make a difference. You touched on that earlier on when you gave that quote about no more, never again. if we can change this one child's life, then something fundamentally can happen to, you change the cycle of life for this particular child. You change the cycle of life for the family. But as I said, the mother is requiring a lot of assistance, and out of this, I mean, the physical surgery is one aspect of it. There's going to be a significant amount of emotional assistance that the family will need, therapy. Again, I go back. We take things for granted. The use of our lips, the use of our nose. He doesn't have a nose. The cartilage is completely ripped away.
Ouch.
His lips are completely gone. There's no lip there. It's got to be reconstructed. The team will have to reconstruct. They're going to have to create a prosthesis eye for him. On the left eye socket is completely broken and the eye is damaged completely. So the things that we take for granted day after day are things that this child doesn't have. So, we're going to be talking about creating first the skin grafts, looking at creating the cartilage, then, making dua to Allah that that all of these procedures work.
Yes.
There's different complications that can arise. We make dua that all of that goes smoothly for this youngster. And then he'll have to go back and forth between South Africa and Zimbabwe, because this is going to be, currently the estimates are that it will be between 12 and 18 months of therapy, various occupational therapies, etc., that he'll have to undergo before he can, utilize lips. He'll have to be taught how to use his lips again, how to eat again, because in this period of time he doesn't have all of that.
Let's talk about I'm glad that you bring up the emotional state of a person, because as we said, it was a very grueling situation. Let's talk about his emotional well-being. Obviously, besides the operation itself, as you were saying, it's not just him, but his mom as well that's going to need that counseling to be able to assist him and be strong for him, to be able to direct him and help him get through this particular situation that he's gone through.
So Sister Makshuda Kaji, who's actually the nurse that was very, very instrumental in this whole process of identifying the child, and she actually went up to Zimbabwe to bring Rodwell and his mom down. And she's looking at it a lot more holistically. So as we said, there's a team of doctors that are currently looking at the immediate need and the immediate situation of plastic surgery and all of the related anesthesia, etc., that go with it. And then Sister Makshuda is actually looking at the more holistic perspective to understand how we can assist the parent, how we can assist the mom and child get back to a normal, if I can call it, some sort of normalcy in their lives. So it's not something that is just limited to the physical part of things. Occupational therapy is also part of this entire thing, because, as I said, without a reconstructed nose and reconstructed lips, etc., require a fundamentally different approach to understand how Rodwell will actually start using these pieces of. This is now going to be it's all of these that are created. How does he now start using his lips again? What are the challenges he may face? The nose, the cartilage is gone. It all has to be there. He's also got to learn to live with some of the disabilities that this brings with. It's never going to go back to how Allah created him. A simple thing like the fact that he's lost one eye. That's also all part of this. So the very good thing about this whole thing, if there's anything, is his attitude. And he's a little fighter, this young boy. He's very positive. He speaks to the doctors. He asks for things that 9-year-olds will ask for. Looks at his books, and he's got the tenacity that is actually, I think, far beyond the tenacity of most 9-year-olds. So that's in his court a very positive thing at this point.
Most definitely. How would other people in the public and the communities, if they're interested in wanting to help out through sponsorship or of course, helping out in any other way, get a hold of you?
Well, they can just simply go to our website, www.mealsa.org, and all our contact details are there. It tells you who you can contact, who you can talk to. And if you wish to contribute online, you can select the Rodwell campaign, and you can contribute via credit card, EFT, whatever the case may be. So we've created that platform so that, as you said, we want the broader community. And alhamdulillah, today we've seen from across the spectrum of South Africans, people have contributed 50,000 Rand and people have contributed 50 Rand. And every cent makes a difference. The bills will literally run into over 1 million at this point. Alhamdulillah, to date, we've collected maybe just over 360,000 Rands. Just through normal social media platforms, talking to people and engaging with the corporates. So mealsa.org, that's your space. Just look to contribute whatever is possible to help this little youngster.
Yes, no, it's a pity we lost Dr. Mitha there with his signal. But I think you've shed a lot of light on the situation that Rodwell is in and what he's going through, and his mom as well. And it hasn't been an easy one. But as you say, it's a long haul. So we're hoping that the public and the communities can get involved in assisting to be able to help him make a difference in his life, a step at a time, as we say, because it's not going to be an easy one. As you said to me, we're looking at 18 months down the line. What message would you like to leave our viewers with this morning as far as the situation is concerned?
I think we all need to come to the party and help this little youngster with whatever we can afford. Whether it's 20 Rand or 200 Rand, and the big corporates can give us more than that. Because it's our duty to assist those in need, and this is right on our doorstep. And it's a very grueling road ahead for this youngster and his family. And I think this is actually something that, all of us can play a role. And with Meal SA being on board, it gives every single South African an opportunity to be part of this campaign. So we'd appeal to everyone to assist us.
It's definitely a phenomenal campaign that's going on, but there's a lot more to Meal SA than just that. So we're also asking the viewers to have a look at your site and get involved in making those differences out there, because that's what it's about. I want to thank you so much for joining us this morning, but I also, it's a pity, as I said, we lost Dr. Mitha along the line, but I want to commend all those frontline workers that have gone out there to be able to, especially during this period, look at a situation like this. And as we're saying, it's on our doorstep, and charity always begins at home. And going out there to be able to try and change this child's life for the better. But we also want to commend Meal SA on the types of work that you've been doing to be able to empower and uplift people, and of course give them their dignity back in many directions. So our du'as are with you. We are going to be following up on the story and hoping to get a hold of yourself and Dr. Mitha next week sometime, just to get a better idea of how Rodwell is coming on and what situation we're in right now. And of course, you definitely have our support as far as this is concerned. And we're hoping that he will get well real soon. And nothing but the best. That's what we want to wish you. But as I said, you have our support from the Salam Media team.
Jazakallah khair, Nafisa. We appreciate that support, and we appreciate the airtime that you've given us. And inshallah, we'll have some better news next time that we chat, inshallah.
Inshallah. Thank you so much for joining us. And on my behalf, I want to also thank Dr. Mitha for trying to get on to be able to give us an idea of the situations and challenges people face, so that we can assist in many directions to be able to put them in a better one. And by showcasing this, we bring light to the matters that are going on out there, so people can, get involved in trying to help and change those people's lives, as I said. So Jazakallah so much. Take care of yourself. Assalamu alaikum.
Salam. Wa alaikum salam wa rahmatullahi wa barakatuh.
That was Mohammed joining us from Meal SA, giving us some insight into Rodwell Komazana's situation, the boy of age 9 who was mauled by a hyena while going to church in Harare. A very grueling situation that he went through. And what we're saying is definitely go out there, support him, and try and make a difference in his life. He's only 9 years of age and he has a lot to do. A very positive child. So let's wish him nothing but the best going forward with his health. And we want to thank Dr. Mitha for trying to hook up with us to be able to give us insight into that matter. We'll be back with you in a minute.